today we're going to be talking about the endocrine system. So here we have the body. We have up here in the brain, pituitary gland, the thalamus, the pineal gland, and then we're going to move down to the thyroid gland, which on the back side has the parathyroid glands, which you can't see in the video, but they are on the back side of the thyroid. Move down into the abdomen region, we have the adrenal glands, which are like caps on top of the kidneys. And then we have the pancreas, which is right in the middle between both of the kidneys. Then down at the bottom here, we have female version, the ovary, and the male version, the testis. Now, as you can see, the endocrine system literally is composed of the entire body. It functions everything in our body that has to do with our hormones. So, hormone imbalances usually related to endocrine system. Therefore, it's a very important, very large system. Now, we have some special illnesses and diseases that do go along with the endocrine system, unfortunately, but there are ways to treat them, of course. So I started with diabetes insipidus, which when most people hear diabetes, they think you're a diabetic, but that does not necessarily mean diabetes in the way you think it does. Diabetes insipidus has to do with hyposecretion of the ADH hormone, which essentially causes defects in your posterior pituitary gland. It can come from any type of brain infection, a head trauma. It can also be hereditary. So diabetes insipidus comes from the pituitary gland region. So there are diabetes insipidus, and then we'll get to diabetes mellitus in a little bit. But next I have hypopituitarism, which also is from the pituitary gland. Pituitary. So if you can break the word down, hypo, excess. So excess secretion of one or more of the hormones of the anterior pituitary gland, which is also caused by injury or defects. So diabetes insipidus, hypopituitarism. Next thing that brings me to is going to be the seasonal affective disorder, or abbreviation for it, SAD, which makes sense because after discovering this illness, it comes from your pineal gland, which secretes melatonin. Now this is caused by an oversecretion of melatonin. So not only are you feeling that sleepy, tired feeling at night, you're feeling it throughout the day. It can come with any type of depression, any type of excess wanting to eat food, more sleep. So seasonal affective disorder, SAD, you think depression, it makes sense. Next I have moved on to galactorrhea. Now galactorrhea is also in the pituitary region. What happens is it's caused by an adenoma or on the anterior pituitary gland. High levels of prolactin are released and can stimulate breasts and women to produce milk, even if they're not pregnant. So, galactorrhea, I think milk and overproduction of prolactin can cause your breasts to produce milk, whether or not you're pregnant. So then we move on to hyperthyroid. So we're in the thyroid region now. And some of these diseases that go along with thyroid, the first thing I think of is going to be the hyperthyroid, which is also commonly known as Graves' disease. So hyperthyroid is when your thyroid is overproducing your T3 and T4 hormones, therefore causing your TSH to be excess. And TSH is your thyroid stimulating hormone, which if you read it and listen to it, it stimulates the hormone. So when you have an excess of this hormone, your thyroid is overactive, and it can cause you to have weight loss, palpitations, feel anxious, anything that you might feel nervous about. Now, Graves' disease is an autoimmune hyperthyroidism disease. So I think Graves' disease, that's an autoimmune disease, and it is a very common autoimmune disease when it comes to having hyperthyroidism. So there on the ladder, we have hypothyroidism, which hypo, less. So that's when your T3 and T4 hormones are producing less than usual. So therefore your thyroid is not as active, and it can cause the complete opposite, which would be weight gain, and can cause low body temperatures, fatigue, honestly, dry hair. Another autoimmune disease that a lot of people relate with hypothyroidism is Hashimoto's, and that is kind of hand in hand with the hypothyroid. So I moved on to the hyperparathyroid, which a lot of people seem to get this one confused as to what it actually does because they think thyroid. But what happens with hyperparathyroid is when your parathyroid is overproducing, and it actually releases too much calcium into your body, which can cause you to be more prone to fractures. Your body's producing way too much calcium because of your parathyroid. You're gonna be more succumb to demineralization of your bone and easier fractures and everything like that. So hyperparathyroidism, and I know that osteoporosis do go hand in hand, just because they kind of work against each other. So then next I'm going to move on to here down at the pancreas. So like I was saying earlier, we have diabetes mellitus, or what a lot of people refer to as sugar diabetes. So diabetes, huge disease, huge autoimmune disease. Your pancreas is overproducing way too much insulin in the body. Then again, your body can also do the opposite and not produce enough insulin in the body. Diabetes is broken down into type 1, type 2, and there's even type 1.5 diabetes. All are managed similarly, but not. Insulin can be given, of course, to treat type 1 and type 1.5, but not always type 2. Some people are insulin resistant. That's what anti-diabetic drugs are for, and some people also have to be treated with both. So diabetes is huge and widespread. Definitely a bigger one of the diseases in the endocrine system. So after that, we have Addison's disease, which this is caused by an elevated release of cortisol, and it is an autoimmune disorder also. It is tied to adrenal insufficiency. So, of course, that's when your adrenal glands are not producing like they should. They're insufficient. So when it comes with Addison's disease, you're going to experience fatigue, weight loss, many symptoms such as they treat it with corticosteroid drugs. So think Addison's disease and corticosteroid drugs. That brings us to Cushing disease, which is caused by long-term use of corticosteroid drugs. And when it comes to Cushing disease, you have the opposite effect, hypersecretion of cortisol from the adrenal cortex. So they're not, I don't want to say opposite, but they do go hand in hand. I have seen people have one and then they've taken medication for so long that they develop the other. Now with Cushing disease, you're going to experience excessive rapid weight gain. A lot of people get what's called a moon face, which is where fat deposits just sit in your face. Also buffalo hump, which literally looks like a buffalo hump on your neck. And definitely you'll see it in the abdomen as well. Just that fat deposits sits and it doesn't go anywhere. So you would definitely want to stop the corticosteroid drugs with this disease. And a lot of times it comes with removal of the adenoma of the adrenal gland. So finally, we move on to the last portion of the body. We have infertility, which can be in both male and female. So when infertility, you're thinking hyposecretion of your estradiol in your females or your testosterone in your males. A lot of times with that, women will have a lack of the FSH or the LH hormone that comes from your pituitary gland, and in men it would be a lack of LH of the anterior pituitary gland. So with this, women experience lack of ovulation, many miscarriages. Men, they don't produce as many spermatoas, and it's just, never a good thing. And then finally, the last disease that I researched was gynecomastia, which also has to do with mainly the men, testosterone. So what happens with that is when you have hyposecretion of testosterone again, but in this situation, what happens, the adrenal cortex is going to secrete your androgens, which turn into your estradiol, but because of your low testosterone levels, they're not able to balance that out. So that's going to come into play with gynecomastia, where a lot of men will have enlarged breast. So the estradiol is overpowering their testosterone. Can be caused by many things. Can be caused by things such as alcohol consumption, not taking care of your diet, just things like that. But yes, that's a common endocrine disease in men. So going over diseases, and then of course we always have several treatments and procedures that come along with endocrine. So just a few that I listed that stick out in my mind. You have the ADA diet, which is the American Diabetes Association. They have special diets that are suggested to people with diabetes to either A, help them come off of their diabetes medication altogether, or B, just help them maintain it. And the ADA is a great organization that has done much research for diabetes. So ADA diets are highly recommended by physicians. Of course, insulin for your diabetics who are able to take insulin. Of course, type 1, type 1.5, and then you have type 2. Some can and some can't. But insulin, of course, to help your body produce that insulin that it's not producing. And then, of course, if you have, your hyperthyroidism, your thyroid supplement hormones, a lot of hypothyroidism, they take the thyroid supplement hormone because their body is not producing that TSH like it needs to be. So you have those. There's several different ones out there: Synthroid, Ormothyroid, Nature Thyroid. I mean, there's so many things out there that can help your body. Of course, when we move on to more of the procedures, when it comes to thyroid, maybe you might have an enlarged thyroid or what's a nodule. Your doctor or physician will want to do a thyroid ultrasound, which uses ultrasonography to take a look at your thyroid, see what's going on, see if there's any nodules, see, lesions. Look at you might have to have your thyroid taken out. They're going to want to do that beforehand. And then, like I was mentioning, nodules, your fine needle biopsy. They're definitely going to want to take a needle biopsy if they find a nodule. They want to test it for cancer. So of course, when it comes to biopsies, you're taking a piece of tissue from that area, you'll send it off, see if it's cancerous, not, and they'll send it back to the physician. Thyroidectomy says it in the word, thyroidectomy, removal of the thyroid. Now you can have your parathyroid removed, you can have part of your thyroid removed, you can have your whole thyroid taken out. But thyroidectomy, removal of the thyroid. If it comes to that, you can live without a thyroid. You just have to have a supplement for the rest of your life. So, and last but not least, adrenalectomy, and that's of course, if you have to have removal of your adrenal glands, due to underlying causes. And there's so much more that you can discuss with the endocrine system, because like I said at the beginning, it does control a lot in your body. Hormones, imbalance of hormones, anything that you think of, most of the time is going to be related to endocrine. But as far as this is my project.